Hi, everybody. Welcome to ADA's webinar on men's mental health. We would like to invite everyone to scan the QR code that you see there to make a donation today in support of Men's Mental Health for Giving Tuesday. My name is Dr. Kevin Chapman. I'm a longtime ADAA member and active member, and I'm also a licensed clinical psychologist and the founder and director of the Kentucky Center for Anxiety and Related Disorders. And I'm very excited to be here for this very important topic, one that is not discussed enough, quite frankly. So thank you all for joining us. We're going to have a wonderful conversation. So with that being said, I am delighted to introduce my fellow presenters to you. So first we have Dr. Oshan Gadsden. He is the Psychology Department Chair at Hampton University. Dr. Gadsden is a licensed psychologist associate and a culturally competent, insight-oriented psychotherapist with over 17 years of experience in providing therapy to individuals, couples, and families. So we're delighted to have Dr. Gadsden. We also have Dr. Dan Singley, and Dr. Singley is the director of the Center for Men's Excellence. His research and practice focus on men's mental health with a particular emphasis on reproductive psychology and the transition to fatherhood. I'm quite excited to hear what he has to say as well. So with that being said, please note we welcome your questions and we'll cover as many of them as we can at the end of the webinar during our Q&A portion. And you may submit them at any time using the Q&A feature that you find within the Zoom call. So now let me turn over to Dr. Gadsden for a short presentation and then we'll open it up from there. Dr. Gadsden, go ahead and take off.
Thank you. Good afternoon, colleagues and all those who are in attendance. Of course, I can't see you through the virtual world, but I know your presence is here. I've been given the opportunity, daunting to me, to discuss or to start to build a bridge in the next 20 minutes around mental health and masculinity. I think it's important for me to start the conversation talking a little bit more about my social location in this conversation. Most of my research and clinical work has been focused on Black males, particularly males who are from the Afro diaspora within the Americas. And so my focus has been broadly looking at gender and masculinity from a general perspective, but more specifically, more interested in looking at the ways in which gender is both internalized, socialized, and performed with Black men. First of all, Black boys. And so I think I've entered this conversation sort of more generally, trying to be more general and talking about some of the ways in which boys in general get socialized related to their identity or gender identity, which is one of their intersectional identities. And we can talk more about the other identities that might intersect with gender and impact mobility, psychological and interpersonal health. And but as we talk about gender as one of those identities, I think it's important for us to really start a conversation off by talking about the ways in which the socialization process or the normative socialization process, because of course there are always outliers given related to race, socioeconomic status, religious backgrounds, and other intrapsychic, internal, and sociological variables that might impact the socialization process of some boys and men. I say men because I think that the gender process or the socialization process is an ongoing process and doesn't stop, in adolescence or in childhood. But the experiences might be different as it relates to a number of these sociological, internal, intrapsychic variables that I mentioned. But I think broadly, if we think about the socialization that boys encounter, it usually is a process that is really antithetical to female socialization. I mean, from early on, infants, even through, and I'm using very stereotypical picture of blue versus pink clothing, the aesthetics, even early on through beginning in infancy, we can see that there is a psychological, aesthetic, and interpersonal demarcation between what is feminine and what is masculine. And boys grow up learning vis-a-vis direct observation or explicit socialization, meaning being told what is proper, what is expected of you as a boy, what your role should be, or either by observation, by what they have seen or observed other men, salient men in their lives, whether they're fathers, uncles, teachers, what has been pronounced or programmed through the media about what are proper normative representations of what it means to be male, what it means to have manhood, what it means to be masculine. And these are interchangeable terms, but also these terms, if we were had more time, we could further deconstruct around how these terms are used interchangeably, but how they have a different aspect to give us or to show us about the masculinity process. And so I think it's important, again, to understand that normative masculinity, the process of the socialization, often legitimizes or demarcates the difference between masculine and feminine. And that demarcation often is internalized in the way that you don't want to be feminine. You want to encase virtues and belief systems and performances that demarcate and make you different from, whether that's in action, aesthetics, sexuality, et cetera, et cetera. I think also the normative process of socialization for males, boys, is also a delegitimization, excuse me, of a full range of emotionality. And so often boys get socialized to really think about a limited amount of emotions that they're allowed to feel. And this often gets exacerbated through sports, and we can talk a little bit about that, around rage and anger. And oftentimes boys are not afforded the same opportunities to have a wide range of emotions or emotionality that sometimes girls and women are socialized and have the permission to utilize and to take on. And then when we think about the influence of the family of origin, the ways in which your family system vis-a-vis their particular belief systems, whether those belief systems are cased in the retransmission of what they understand masculinity to be about, or whether it is informed by their own morals or religious backgrounds, you can see that there are a number of ecological, familial variables that get internalized into boys around what are proper gender roles, what is proper gender identity. And often, again, as I said, those messages and those internalizations often delegitimizes the opportunity for men and boys to have a full range of humanity. To believe, first of all, that they have a full range of humanity, but often I see also in clinical work with couples that even spouses don't often understand or perceive the full range of emotional possibility that men have or that boys have. And so there's this internalized way of thinking about oneself as a boy and a man, and then the perception of others that really confounds the process of gender socialization, or what it means to be human and to be male. And of course, painting that picture, one could obviously believe and understand that there would be a number of psychological, interpersonal, and cultural and spiritual, from my perspective, implications or effects of such a socialization process. And some of those that have been found in the literature are negative interpersonal outcomes, right? If you have males who have a difficulty emoting or have a rigid emotional reservoir that they've tapped into, or don't feel feel fully human or fully seen or heard or understood, you can see how that can have huge interpersonal outcomes in trying to relate and understand others. Other things that that the literature has found in terms of the impact of normative or hegemonic or limited ideas of masculinity would be gender role conflict, hypermasculinity, poor health outcomes, men who are somaticizing these psychological issues into their body, high blood pressure, high cortisol levels have been found, identity confusion, negative relational romantic outcomes. And of course, one of the things that we don't talk a lot about with men is shame and guilt around the difficulty it is, one, maintaining what is expected as it relates to normative gender roles and expectations, but also when one feels something different, not being able to actualize that because of a host of ecological or psychological variables that make one feel that it is impossible or difficult to live out that authentic self. And so these are just some of the psychological, interpersonal, and spiritual outcomes that we've seen in literature as it relates to men who and boys who take on and internalize normative, rigid, non-expressive ideas of themselves that are wholly connected to their idea of gender. And of course, this gets more complicated when we add on or discuss the other intersections of identity that, of course, men hold. You know, how does one's race intersect with one's gender? Does it complicate the issue? How does one's sexual orientation coexist with one's gender? Does it, again, complicate one's life? Socioeconomic status, we can go on to other identity identifiers. And so I think it's really important for us to think about how this socialization process that I've really condensed to a minute or two, and the implications of this socialization process then gets internalized, and how people or how men and boys attempt to cope with these various stressors as it relates to their sense of identity. And how these coping strategies, as Margaret Spencer so eloquently says through her PTSD model, how they become emergent identities, right? How they get internalized and men take on identities, ways of being that maybe are not authentic to themselves, to who they can be, maybe not as thorough or complex, but as a consequence of survival and making do with the world in which they understand and the way in which the world understands them, they perform it. And so there are a huge number of psychological implications for this that I have seen, and I'm sure that my colleagues have seen in their practice and in their work with men, particularly I've seen particularly around anxiety, depression, and role confusion, guilt. See, these are some of the major negative psychological impacts and emotional impacts that I have observed in clinical work with men that ultimately always arise as we start to talk about how is it that you have managed or are managing, making sense of the stressors in your life, general stressors, but those stressors specifically that are related to your identity of maleness. And oftentimes patients, men, are talking about this sense of shame, this sense of guilt, this sense of anxiety that arises in the dissonance of what is supposed to be or how they are supposed to be, function, and act in contrast to the things that they might wish to be or how they might wish to show up in the world. And so I think it's an important time, as I close, an opportunity for us to have some genuine, complex, deep conversations about this process that I mentioned, this socialization process. And of course, it's ongoing because even as men, given vis-a-vis the particular context that we may find ourselves in, we may get re-triggered around how to speak to issues around masculinity. It doesn't stop because of the developmental age. It persists for many men around how am I showing up in terms of my masculinity. How is it observed and perceived by others? How is my spouse, how is she expecting or he expecting? And how is that impacting me? How are my children seeing me? How does my masculinity impact my vocational pursuits or the expectations of those in whom I work for or with? And so we can't run away from it. And so we have an opportunity today, hopefully, to begin to really think about the complexity of how this socialization process informs our psychological identities, emotional capacities, and willingness as men, and what we can do, whether we are practitioners who are treating or seeing Black men or men in general, regardless of race or other intersectional identities, or whether we're spouses or friends or colleagues. What is the language that we need? What are the things that we need to be observing or looking for? How can we help men in general open up in a way that taps into, as I believe, they're already internalized capacity. It's not that men don't have the capacity for full ranges of emotionality. It's not that men don't have the capacity to live expanded lives, but often the environment, the ecological environment doesn't allow that pursuit or that capacity to be to emerge. And so what can we do? And as our colleagues talk today, I'm sure they have from their many years of expertise, ways to think about how we can expand our conversations and introduce new models of masculinity that are psychologically, culturally, and spiritually empowered.
All right, I appreciate that, Dr. Gasson. There's a lot of good insights in that, and I think that that's a really nice segue into us asking some questions that we already have moderated, and then I'll open it up to the audience to feel free to delineate questions that they may have as well. So I think one very important, obvious question to the panelists here that I think is a burning question, and Dr. Gasson, you mentioned this already to some degree, but I'd like to hear more detail from others as well. But why is it so important for us to talk about men's mental health? Like, what's the big deal about talking about men's mental health? What would you say? Why is that a big deal? Why should we do that?
Okay, I'll it's a great question. I'll jump in. I think briefly, because men and boys and masculine identified people broadly are suffering and dying on average 6 to 7 years younger than they need to. And there's a whole wealth of very solid research that begins very early in childhood, looking at a lot of the factors that Dr. Gadsden just laid out in terms of the socialization, the relationship to one's own emotions, interpersonal relationships, and certainly sociocultural, institutional factors that contribute. Just so I, this can be kind of a tricky comment to make, because in a lot of ways we're not used to thinking of men writ large as experiencing marginalization. And that's very understandable, but certainly as Dr. Gadsden was starting to talk about Black masculinity and there are, other pockets of ways in which the ways how we socialize men actually causes us to shut down and to suffer and to die sooner. I could say a lot more about that, but that's my top level answer to your question.
I would add to that, that's a beautiful response. And we could be here all day answering this one question. But I think in context to the work that I do as well, is that marginalized men have often have not had a voice. And when you think about the research that has been conducted or put out related to marginalized men, it's always are framed from a deficit model. And so I think what's important and a part of my research as a qualitative researcher is getting men to talk about their own subjective experiences. We want to know their narratives. We want to know the phenomenological lives, the subjective lives of our men, because they know themselves better than sometimes, obviously, the researchers may, and even people who are close to them. And so I think it's important, one, because men need to set the record straight or be able to talk about their own subjective experiences. Two, having this discussion really is a social justice initiative to me, because it allows men who often feel marginalized, who often feel silenced in multiple contexts of their lives, to begin to talk about what they're feeling, whether that conversation is distorted, you want to use that word, whether there's room to grow, but giving them the opportunity to have their full humanity and to be a part of these conversations is another reason why this conversation is important. The third, and I'll stop here, is that often these statistics get convoluted when we talk about male privilege. And I don't want to start that. I don't want to start that conversation because that's a hot one. But when we think about marginalized men, it doesn't bear out. It doesn't bear out in the education outcomes. It doesn't bear out in the social outcomes. It doesn't bear out in the political outcomes. And so I think this is also a conversation to begin to demystify what we mean by male privilege. How useful is that term? How useful is the term of toxic masculinity? What do we mean by that? If there's toxic masculinity, is there toxic femininity? Are these terms producing healing and change and shifting, or are these terms further dividing us and making it hard for us to have psychocultural, spiritual empowerment and reconciliation? So those are the three things that come to mind for that question.
Thank you. That was a great response. So I have another question. So what are some of the signs and symptoms that one can look out for that may indicate that men are struggling with their mental health? What would you say, some signs and symptoms that men are struggling with their mental health? And either one of you all can jump in, and I may have something to say as well.
All right, I'll hop in. I find it really interesting. So we talk about depression, and this is an ADAA webinar. For those of us that focus on psychology of men and masculinities, we talk about, it's not in the DSM, but so-called masked male depression or major depressive disorder male type. And that gets at the phenomenon in which a lot of times, commonly, men and boys will manifest a flavor of depression that looks a little bit different than the sort of shut down in the corner and weeping and completely isolated. And some of the key signs for that masked male depressive presentation include frustration, irritability, sometimes on up into rage, an increase in drinking or drugs or really dopaminergic behavior broadly, video games, jumping out of planes, risky sex, this sort of stuff. Also, Dr. Gadsden mentioned somaticizing. This is a pretty common aspect of this kind of depressive presentation. So I can't be depressed, but I can have stomach troubles or muscle tension or migraines or what have you. And then finally, looking for isolation or withdrawal. And this is very important. It doesn't mean that this man or boy isn't around other people. It means he's not engaging. So you can be around people at home. You may live in a multi-generational household. You're around people all the time, whether you like it or not, but you're not engaging. Or if you do work outside the home and it's not that you're not around them, it's there isn't that sense of connection. And we could take this off in the direction of men and isolation and sort of the friend gap and not having that closeness and intimacy later on in life that we sort of socialized out of boys. I think it's interesting to point out as well, the DSM-5 just put out a revision, which includes in the major depressive disorder section, a really quick statement about gender and male externalizing and female internalizing tendencies and And so I'm happy to see that that's sort of percolating up into the diagnostic criteria.
Yeah, well, that's great. I would add to that that was I don't know how much to add to that. That was great. In terms of what I've seen clinically with marginalized men is the anger. I was just talking to when I was on a show the other day, and someone was the panel, the host was asking me, well, what does healing look like for men? And what are some of the components of that healing process, and what are some of the things you see while that process is happening? And one of the first things I said to them is anger. And he said, anger at you or anger at themselves? And I said both, because anger at me, because the question of the exploring is triggering this idea that is there something I'm missing here? I've been living all of these years, and something is missing, and so there's anger about the possibility that my life is not as thorough or complex as it can be, and then of course the anger also about the experience of being a male or being a man in the world, and thinking about the developmental experiences and all of those people who have contributed perhaps to their particular identity understanding or their psychological woes. And so I think I see a lot of anger. I also see a lot of shame. And I talked about this earlier, shame in the sense of, I get a lot of men who are living unexamined but inauthentic lives. In other words, that they have dreams, ideas, ways of seeing themselves that they have envisioned but could never live it out, because of the complication of gender and religion and other identifiers that they've internalized or they've been socialized to believe are normative or right. And so, for the first time, many men in therapy with me are articulating visions and dreams that they would dare not talk to their closest friends about. So those two emotions I see more often, anger rage, and shame.
Yeah, I do agree with that, Dr. Gaston and Dr. Singley. I think what you all said hit the nail on the head. I won't add much, but I will say this. I think oftentimes we often fail to realize that so many of the emotions we all experience have significant physiological overlap, right? So we think about anxiety, we think about anger, we think about fear, we think about shame. And men, because of many of the variables that you all have already extrapolated, are socialized to perceive that arousal, right, as out of control. And therefore, I'm socialized to externalize as opposed to do other things with that arousal. So I just wanted to point that out. I think that's an essential point, is that if we can get, right, boys early on, and men, of course, in particular, to recognize the symptoms and signs of emotional dysregulation, knowing that all emotions serve an adaptive purpose in our lives, and knowing that all of these emotions we do have, whether or not we manifest them based on cultural display rules and whatnot, I think it's essential that we have that conversation, right, with men in general, that this idea that emotions serve an adaptive purpose and there's overlap physiologically, and therefore when I can recognize what anxiety is, when I can recognize what frustration is, when I can recognize and label what anger is, that's going to help me. And like G.I. Joe used to say back in the day, knowing is half the battle. So if I know what the emotion is, it can actually help me navigate situations to trigger it. So yeah, that's a great discussion. So another question, and this is a loaded one. I think you'll like this, but so why do you think that statistically men are less likely to seek support and treatment for their mental health? Right? I mean, Dr. Singley mentioned the DSM, and we know we talk about prevalence rates and whatnot, and we talk about women often have more symptomology than men and whatnot. And those of us who actually see men in practice, we know that we see them often at similar rates, but nonetheless, they don't talk about it. So in many ways, why do you think that statistically that's the case for men to be less likely to seek mental health treatment?
Well, I'll take this one first. I think it depends, or it matters around other identifiers, and I would like to see the statistics around men of other races, but particularly Black men, because they're stigmatized. They feel stigmatized. There's a huge history and also current colluding with many clinicians who do not know how to treat Black men. So why would Black men want to seek treatment? And of course, given the statistics of Black male psychologists, therapists, social workers, and other POCs of therapists, there's just not enough of us or them to go around. Also, you know, just because you're a Black male therapist or a psychologist doesn't mean that you're culturally competent either. So anyway, there's this stigma that lots of Black men have already internalized around the medical and mental health field, and rightly so. And so I think that we have to demystify that, show them that that is no longer true, provide spaces where they can feel held and heard, both psychologically, culturally, and spiritually. I think another reason why men in general don't is because, and I see this a lot in couples therapy, is because there's an assumption when the spouse brings the man that he is the presenting problem. And that you must fix it. You must, no, sister, no, brother. You are part of this system. You are part of the dysfunction. And so I think that men often go in already feeling that they're not going to be heard, they're not going to be regarded. The therapist or whoever is going to collude with whomever, and it's going to be just another cycle of them feeling invisible.
Phenomenal points. And to add, Dr. Gadsden, you made the very important point in your intro. Essentially, the number one way to enact masculinity is to not be feminine. And I see this dynamic, the socialized dynamic, as being very much at play in the robust many years of literature on men's help seeking in mental health, as well as more broadly in medical health. And so I also have to make this point. It is Movember. That's why I've got my old man Hulk Hogan mustache here, drawing attention to men's mental health, including, of course, one of these ways that I see men dying across the spectrum is the shame related to so-called below the belt issues, prostate cancer, testicular cancer, different sort, prostatitis, like the conditions that are, but the shame around, oh no, I'm not going to the junk doctor, and that's not even getting to mental health. Now, one of the ways that I see this playing out in mental health is this sort of the anti-feminism, right? Which in this context doesn't mean you hate women. It just means I'm going to be masculine by not being feminine, as the way I'm going to enact it. Well, we as a society have largely feminized the field of mental health, right? It's included in one of the so-called, pink collar professions, nursing, teaching, there are a series of them, right? Nobody says female nurse, right? And if you look at the statistics around gender and the pipeline of who's in psychology and LCSW and master's family programs, it's not as many men, getting to the point that Dr. Gadsden made. So I think it's really important to look at some of the research that addresses the question of seeing different sorts of treatment modalities and addressing mental health as weak, as feminine, and certainly different cultures have different norms around mental health and what it means, and unfortunately very few of them get to the point of broadly at a societal level saying, hey, this is a good thing. Everybody needs a tune up now and then. We just don't hear as much of that.
Excellent point. And I think Dr. Gaston, you mentioned a lot about this already, but let's make it explicit. This is great. How does the concept of masculinity interact with mental health? So just to kind of extrapolate some of the things you talked about already, but how do gender roles, race, fatherhood, Dr. Singley, things like that, and the expectations of men, how does that impact mental health, men's mental health?
Woo. I'm a part of a national tour called Just Heal Bro Tour. And we go city to city talking to men about these types of issues. And I often talk about the John Henryism aspect for Black men. This, and I think it applies to men in general, but it impacts us because we are expected to carry the weight of families, making decisions, all of those things which would come with the expectations and the roles and normative gender roles that men play into or feel like they have to play into to survive. And that has, as we talked about earlier, has huge somatic issues. I mean, studies that show high cortisol levels with men who are experiencing gender role conflict, right? Talking about issues below, colon issues, stomach issues. And so it has huge somatic issues. And people and men who feel encapsulated and limited by the roles or the expectations often are not as joyous or happy. There's a study that I'm trying to get together, and I've just talked to people just anecdotally. It's a joy pleasure study. I want to do a qualitative study asking men about their definition of joy and pleasure and where they've experienced that. And when I talk to people anecdotally, they're like, what? Joy? Men? Joy, pleasure. No, I just do what I need to do. I have all of these responsibilities. I have, their definitions of what joy and pleasure are not complex. They're not nuanced because I don't think men get an opportunity to really delve into multiple aspects of joy that are for them, not what I'm supposed to be doing for others, but just as a consequence of what makes me happy and makes me fulfilled. And so, just in short, as you can imagine, all of these things take a toll on how men feel authorized to not only live their lives, but also how they feel authorized to be connected to other people. If you're dealing with these types of internalizations and concerns, it makes it really difficult for you to have real, genuine, deep connections with other people. So those are some of the ways I think that interacts. Masculinity, these roles and expectations interact with mental health.
Yeah, I was laughing with my mute on because this is a huge question. How does masculinity intersect with mental health? It's like, all right, let's close the doors. We're doing this all day. So just to give a specific example that I think highlights. So my research and a lot of my clinical practice is in perinatal mental health. So paternal perinatal mental health, and it's within a field that we often refer to as maternal mental health, and I think properly should be parental mental health. But I'll get off my soapbox there. One dynamic that I've seen play out, unfortunately, over and over and over again, and the specific example I'll give are some African American dads that they come to me. Sometimes it's them, sometimes it's a couple, but it's the perinatal period. So they're usually preparing to or just became fathers. And in going through and doing an assessment and coming to try to understand them in the way that they understand themselves, a lot of times what will come up is they're experiencing a specific form of transgenerational or intergenerational trauma. And it's gonna sound kind of weird coming from a white guy, but like doing the trauma-based work generally starts with helping somebody to find the words. And the biggest trope around fatherhood, if you stop and ask somebody like, hey, what does it mean to be a dad? They usually protect, provide, sacrifice. Like that's what we come with. And it's fine. These are noble. There's a lot more to it than that, but those are what's usually had. And so the dynamic at play is a lot of these fathers, these Black dads who themselves have experienced racism, microaggression, macroaggression, and marginalization, and a membership in that group have that sense of the trauma of being us, and inevitably we'll get to the point of, you know what, I had my parents had the conversation with me. You see the rollers, you pull over, hands on the steering wheel, yes sir, survive for the next time, right? Well, a lot of times these dads are who are being told you got to protect, provide, have experienced an inability to protect themselves, to be out of control themselves. And now they're being told, I'm going to bring this little black boy into the world, and I am not going to be able to protect. I'm going to have that conversation about hands on the wheel, yes or no, sir, survive. And this is a way in which, in a very sort of paternal specific lens, that I see masculinity and the fatherhood identity intersecting, because this experience of I can't enact this protect, control part of what I'm being told. Now, thankfully, I see masculinity as under construction, and it's evolving really quickly in the fatherhood space. To me, it's a very exciting time to be doing this. And so it's nice to also be able to say, like, okay, look, Dad, yeah, that's all important. And what about being emotionally available? What about being a good teammate? What about being able to like own up to mistakes that I made and teach my kid about empathy and closeness and connection while protecting, while providing, but bringing those other dimensions to it. So that was I want to give a specific example of a way that that question plays out in a lot of the work I do.
No, that's powerful, Dr. Singley. That was, I really appreciate that perspective, and I'm glad you highlighted the work you do, because that was a really cogent point that you made. Thank you for that. Man, this is good. I think everybody's enjoying it. I'm watching the chat and monitoring, and I would encourage everyone. I can't promise you that we'll get to your questions, but please feel free to throw some questions in the Q&A section of our webinar. I would really appreciate that. There's some really great questions. We'll hopefully get to some of them in a minute, but one last question, and then I'll open it up to some audience questions. How do we start having more conversations about men's mental health and wellness? Like, how do you think we do that? I mean, I'll go ahead and tell you the spoiler now. Part of it is what we're doing right now, so don't say that. But I think in addition to that, like, how do we start? We collectively, right? Have more conversations about men's mental health and wellness. What you think?
Well, you stole my answer.
I figured as much.
You shut that down. Wow, that is a great question, because we've been talking about the socialization process, sort of like an innate or automatic process that happens without really talking about the fact that we all are perpetuators or complicit in the socialization process. And so I think Bell Hooks was talking about this many years ago, when she was talking about the need for us all to admit, to explore how complicit we are, whether we are, however we identify sexually or in our gender, race, etc., how we are complicit in the ways in which boys and men are socialized or are limited in terms of their full humanity. So I think that part of this question, the answer, is that we all have to admit, we have to be willing to admit that we all in some way are complicit with some of these statistics we've talked about, the presentations that we've discussed. And then we have to make a honest, I don't want to use the word structure, but what are we going to do? Everybody has to have a part of the responsibility. Like, what is my part of the responsibility in shifting these conversations and bringing healing to men and legitimizing masculine space or life? You know, what is my part of this? And whether that conversation is in a broad space or in a large space like this or on a platform, or whether that's relates to the influence that you have on a day-to-day basis. You're a teacher, you're an educator. So how are you going to put forth this new expansive conversation? You're a doctor. How are you in your practice of medicine? You are a psychologist or a therapist. How are you going to, so in your sphere of influence, how are you going to tap into these conversations, lead these conversations, be a part of these conversations, and help legitimize masculine life and help men and boys begin to have spaces of healing? The last thing I would say to your question is that we need more spaces like Just Heal World Tour, where men and women have been doing this, and it's been legitimized, where men just come into spaces by themselves and can just talk about their subjective experiences. And we know, as we've just discussed, as a consequence of the ways we've been socialized, it doesn't mean that they're going to talk about or say things that are healthy or things that we might consider healthy, but they need the space to start from where they are. So we need more spaces where men can be alone with trained facilitators like my colleagues who have done their own work and help men begin to rediscover, or in some cases discover for the first time, their authentic voice.
Okay, I'm basically just going to piggyback off of what you just said, because I'm like, yes. I think in many ways, I see an important part of the solution as being about balance. So for the first, 25, 30 years or so, at least in psychology, the psychological study of men and boys and masculinity was what's wrong with men. Intimate partner violence, suicide, depression, and these are critically important topics that need continued research. But it's really only sort of in the mid-teens that there was a concerted focus on positive psychology and a strengths-based approach in masculinity's work. So Dr. Getz and I was laughing when you were talking about doing a qualitative study on joy and pleasure, which I'm like super interested to hear about. One of the ways along those lines, it's not exactly joy and pleasure, but I will regularly ask men, hey, what's right with you? And they give me a weird look. I'm like, I'm asking you, what's right with you? And even answering that question violates a bunch of social norms. Don't stick up. Don't start, don't be cocky. Don't be putting on airs like all this routine. Right? Just being able to say that itself takes some inertia to get over, which goes against that balance. So then how do we have those conversations? And I could not agree more. We at our center here in San Diego, all of us run men's groups. Interpersonal process men's groups, or like a mindfulness men's group, or like anxiety focused men's groups. It's just pretty easy to sit with me and be like, he's a shrink, like he's paid to say that, like, and to minimize me, to turn me into like a thing or location or whatever. You can't do that in a men's group, because those are also just other men and people. And I will see folks that may have plateaued in some individual work that we're doing. You get them into a men's group where they are able to really get that sense of universality, and it's not just me, that they take off. But there are so few of those spaces in secular settings. Now, I will say mosques and temples and churches tend to have like a Bible study group, or get together and there's a men's fellowship or something. And I'm not especially religious myself. I am all for that, because it gets the men in contact with each other in a way that they can have that sense of fellowship and connection. The last thing I'll say is one of the ways so I'm a member, I'm actually the current president-elect of the APA's Society for the Psychological Study of Men and Masculinity. We're Division 51. We released about 4 years ago at this point, the first APA guidelines on psychological practice with boys and men. And to me, at least within my field of psychology, that was a huge step forward. And it was the result of 10 years of work that a bunch of my colleagues had done. It was a very, very sort of iterative process. But in releasing them, not only is there really helpful, very well researched information in those guidelines, but in releasing them, it brought a spotlight and said, this is a dimension of cultural competence. Yes, it's true. The history of psychology was a bunch of old white guys in lab coats and setting the parameter. 100% agree. That doesn't mean that we don't need to understand gender across the spectrum, including masculinities. And so I do trainings and like this about the guidelines and how to apply them. And to me, that was another really, really important step that we were able to. Actually, the British Psychological Society just released their guidelines on men and boys as well, slightly different frame, but starting to see more of that, and I'm really happy about it.
Thanks, Dr. Singley. I appreciate that. So we do have a few, we have several questions. We won't get to all of them, but we do have a few minutes to address some of these. So let me kind of generate one of the questions that we received from one of the audience members. So here's one really good question. So what can one do to get a man to open up and talk? In my experience, the topic has quickly changed to sports or politics, something easier. So what's your thoughts about that? How can you get a man to open up and talk? And sports and politics usually are easy topics.
Ooh, now I don't know if that question is from someone who identifies as a woman, because I'm going to be biased in my answer to that. Well, it really applies regardless of how you identify in terms of gender. But the analytic thinker in me, first of all, psychoanalytic, is first of all, and I say this over and over in presentations to spouses of men and people who are connected to men. First, it would be important for you to more deeply understand your motivation for asking that of men, or asking that of the men in your life. You know, what is motivating you to ask or demand or require or expect more emotionality, more openness from that man? Secondly, does the relationship in which you have with that man, has it shown him, or is it deep enough for him to feel safe enough to show that part of himself, or those parts of himself? So I think that there's a misnomer that that people should just emote, or people should show or be vulnerable just because one asks or one desires it. But if the relational frame is not strong enough to even ask that question, why should someone be open or vulnerable with you or to you? Especially, particularly given the enormous or the complexities of how men are socialized and the variables that they are encountering developmentally and currently. All of those things that they, so it makes it much more difficult. So first, what is the motivation behind your request? Does the relationship itself, can you ask that of that man? Does the relationship, the frame of the relationship, is it strong enough to withstand that type of intimacy that I think you're asking for, and vulnerability? And then thirdly, what I talk to spouses about and couples is, now, are you willing to show that same level of vulnerability? And when he shows that level of vulnerability, can you tolerate the response in a way that enables him to feel safe enough to continue with that vulnerability? So I think Dr. Singley and my other Dr. Chapman, you can answer the question more directly, but I think I'm answering, this is the before stage. This is sort of the framework, before we get into sort of the, components of how to ask, and, the top 3 strategies on how to engage men. I mean, we can talk about that, but I think before we get there, the questions that I've asked are really important to really consider, because men have feelings too. That's what we've been talking about, and we tap into and can pick up on things as well. But I think we have to have a level of mutual honesty as it relates to our motivation and how we're setting this dynamic up with men in general.
Thank you for that. I just had a real quick question for the two of you. If you can address it, great. If not, then we'll just move forward quickly. But someone in the chat wondered, how can they find a support group for male victims of domestic violence? So they've searched high and low and they can't find anything in that area. Either of you all know of such a group that comes to mind?
They are few and far between. So when Dr. Gasman earlier was talking about, marginalized men and marginalized groups of men, this is one that I think the figures of about 25% of victims of intimate partner violence are males. And the resources available for the males who are IPV victims are very few and far between. And I wish I could say, oh, well, go to this website. But I've done that. I've actually done the research to look up some of this, and I'll say, like, okay, I have search parameters that include males, and you actually do the search and you actually follow up, and it turns out no, like this is one of those. It's a phenomenal question. I wish I had a better answer, but male victims of IPD are an incredibly underserved population.
I think I would respond the same way, but I just want to hone in on it so that we understand the seriousness of it. You know, the 25%, I would, you know, and I think about, I don't know if that statistic includes men of different races or how that was sort of normalized or things of that nature, but that's a huge percentage. I want us to hear that and really sit with that there are 25% of males within our populations who are sitting with being victims. Given vis-a-vis the ways in which we're socialized, can you think and imagine the impact that that is having on their lives? I remember a patient who I was seeing married to a woman, and she just always, when she got angry, she just hit on her. Now, of course, if it was the other way around, there'd be huge legal implication, forensic implications. If he even thought about hitting her back or reacting, there are huge implications, not just around his gender, but even being a Black male. And so we talked a lot about what it meant for safety. What does safety look like? You know, this intergenerational transmission that was happening because his children were witnessing this. What was that about? And how to keep himself safe. But I think it's really important for us to really sit with the fact that men are being perpetuated in this way, that they're victims, they're not just always perpetuators, and that this has huge impact on the self-image of males. And we think about male privilege. This is what I was talking about earlier, specifically around minoritized populations or minoritized men. We have to really think about whether that term fits, how useful it is. It's useless to me, but how useful that term can be. And then lastly, I'll just say to this point is I think clinicians also have to be thoughtful about their own unresolved valiances and archetypes of men. Because when I talk to students who I train, particularly women and even some male students, it's hard for them to even fathom having a male patient who fits this being a victim of domestic violence. And I think that that's huge because these are the people who are treating, if men show up in these various facilities, whether they are forensic facilities, community mental health, or private practices. So I think we have a lot to do also with the ways in which we train clinicians and really helping them to unearth their own unresolved archetypes and valiances around men and what can happen to men.
Excellent response. I appreciate that. And like being tasked to be the host with all these excellent questions, like, don't y'all throw lettuce and stuff at me, all right? Like, this has just been a phenomenal, this just speaks to us having to do this again, right? So I'm sorry that we can't get to all your questions, but let me just have one more wrap-up question, Dr. Gaston, Dr. Singley, just a quick response to this. But how would you say the pandemic and whatnot and more social isolation has affected men's mental health, like having to work from home more and things like that? Would you say that's had a significant impact on men's mental health?
So it has strongly impacted most people's mental health, and when you look at specific groups like men broadly, uh, it varies. And then when you start looking at men that used to work outside the home, men who maybe didn't, um, you know, Black men, Asian American men, Latino men, it's hard to say that really broadly. But what at that level of generality, yeah. One of the things that I've seen over and over and over again is um, the isolation that men were experiencing anyway just hit the afterburners, and there was this kind of like accept, well, it's COVID, so of course everybody's lonely, and the sort of acceptance of, or the normalizing of that separation, I think has done a real number on people's mental health broadly. But that very lonely and just sort of disconnected men, oftentimes those men are trying to get all of their intimacy needs met by one person, usually their partner, and doesn't matter how great he, she, or they are, that won't work. It will fall apart, and they'll end up resenting the person who can't meet all of their needs when it's actually on me to go do it. So that's one really important way. On the flip side, I have seen COVID normalize mental health issues and needs. And so there's more of like, I live in California, right? So we talk about mental health, like it's a very regional sort of. Here in California, you hear more of that. What I've seen for colleagues of mine that are in Kansas and Nebraska and areas where, you know, there's more sort of traditionality around it, folks are talking about talking to a counselor and mental health more. So that's kind of on the flip side, one way that I think COVID has gotten that conversation a little bit more in the spotlight.
Okay, thank you, Dr. Singley, for that. So we got to wrap up. We're at the top of the hour. I know folks have to go. So thank you all for joining us today and helping us break the stigma surrounding mental health. Just a reminder, we encourage you to take advantage of the many helpful resources on our website at adaa.org, where you'll find a number of things: a list of treatment providers and our Find a Therapist platform, free peer-to-peer online support groups, which is phenomenal, by the way, a library of free educational content, including blog posts and webinar, such as the phenomenal one you just saw. So thank you everyone for joining. I don't think this will be the last time. So thank you and have a great day.